Now, when we talk about this primary health care, now we have 3 tiers of government. We have the local government, the state government, and the federal government. And in the primary health, we also have the secondary institutions. We have the tertiary institutions. Now, every now and then, governments mount equipping, building primary health, building facilities. Now, what are those basic things that we should begin to apply so that we don't wake up the next day, maybe tomorrow or next year, still talking about equipping our primary healthcare centers? What can we do differently from what we're presently doing as a people to get these things running?
So you are right, Ash. The truth of the matter is we run a disaggregated healthcare system. We have the primary healthcare, which is run fundamentally by the local government. We have the secondary healthcare, the cottage hospitals and general hospitals, that is run by the state government. And then we have the tertiary healthcare, teaching hospitals and federal medical centers run by the federal government. So in short, we have the most important level of healthcare run by the weakest arm of government. I don't need to tell you that the result of which is what we are seeing today. Because this, and until we can change this, I don't know how. I'm not a politician. I didn't do political science, economics, or government. But until we can change this and get everybody to understand their ownership of the primary healthcare system, I don't know that things are going to change very much in the near future. So definitely one of the things we have to talk about is that when you're talking about primary healthcare, you're talking about an integration of components. You're talking about an integration of health services from primary healthcare all the way along the public healthcare functions: water, sanitation, immunization, education, literacy, food security, agriculture, road networks, security. Then we're talking about a multiplicity of policies that are going to come into this to make sure that it all comes together. The most important component that we don't seem to be paying much attention about is what we call community engagement. That is that the families, the individuals, the families, the communities are involved actively in decisions concerning their healthcare and service delivery. Ash, I think you will recall a conversation we've had many years ago, not too many years ago, I'm not that, but some time ago, where we said, let us send everybody out. Go to the nearest healthcare, primary healthcare clinic near your house. Take a picture. Yeah. Send it to a central point. Maybe they send it to you. Let everybody begin to understand. If I have a problem, a fever, I cut my finger, where am I going? Is it functional? Is it 8-hour functional? Is it 24-hour functional? Do they have personnel? Do they have equipment? Do they have consumables? Until we, the people, rise up and take ownership of our health, we can't expect government to step off their high horse and come and do it for us. They have clearly shown that they will not.